Hi, today I'm going to be talking about the relationship between menopause and insomnia, and I'll be touching on the mechanisms and treatments. So what is menopause? Well, menopause, defined as the point in time when 1 year has elapsed since a woman's last period, is a natural process that occurs as women age, and it affects all people who menstruate, some very significantly. As such, it is important to understand the symptoms that can emerge during the menopausal transition, how they can affect one's physical, emotional, mental, and social well-being, and the effective treatments for these symptoms that are currently available. So when is menopause? Well, the menopausal transition typically begins when women reach the age of 47, with the median age of menopause being 51 years old. So before we get into this, let's go over some terminology to get us all on the same page. The Stages of Reproductive Aging Workshop, or STAW, characterized reproductive aging by broadly grouping women into 3 categories: reproductive, menopausal transition, and postmenopausal. Perimenopause is a common term that is also used, and it encompasses the period of time from the menopausal transition to the first year after the final menstrual period. So what is happening in the body during menopause? Well, several years before menopause, a woman's ovarian function starts to deteriorate, and the function of the hypothalamic pituitary ovarian axis begins to change gradually. Generally, levels of the follicle-stimulating hormone, or FSH, increase, and levels of estrogen gradually decline throughout the menopausal transition. With these significant changes in the body comes the emergence of a wide variety of symptoms. Sleep alterations represent a key symptom in the menopausal transition. So insomnia disorder is the most severe clinical manifestation of recurrent and chronic perceived poor sleep and has been found to be the most frequently occurring sleep disorder during menopause. Insomnia during menopause is associated with adverse effects such as poor quality of life, decreased work productivity, increased healthcare utilization, and a higher prevalence of anxiety, depression, and cardiovascular diseases. Mechanisms causing insomnia in menopausal women are multifactorial and involve hormonal changes, hot flashes, and mood disorders. It has been well documented that sexual hormones can affect sleep. For instance, estrogen, which decreases during the menopausal transition, has been found to shorten the time it takes to fall asleep and decrease the number of awakenings during the night. Accordingly, Cray and collaborators found that low estrogen levels are associated with a greater severity of awakenings. Hot flashes are sensations of heat, sweating, anxiety, and chills that can last between 3 and 10 minutes. Studies have found that 79% of perimenopausal women reported having hot flashes, and that hot flashes have been strongly associated with poor self-reported sleep quality and chronic insomnia in middle-aged women. Moving on to mood disorders, Bromberger and collaborators found that women were 2 to 4 times more likely to develop major depressive disorder in the menopausal transition and early postmenopause compared with premenopause. And, as you already may know, depression is strongly associated with sleep disorders, with 3/4 of depressed patients found to experience symptoms of insomnia. Okay, so moving on to treatments for insomnia in menopausal women, we will be focusing on cognitive behavioral therapy and menopausal hormone therapy. Cognitive behavioral therapy for insomnia, or CBTI, is a multimodal intervention which targets both cognitive and behavioral factors that contribute to insomnia. McCurry and collaborators evaluated the treatment efficacy of telephone-based CBTI versus menopause education control, or MEC, which provides general information about menopause and women's health in peri- and postmenopausal women reporting insomnia symptoms. They found that telephone-delivered CBTI was more effective for improving sleep compared to MEC. Menopausal hormone therapy, or MHT, has been long considered to be an effective treatment for many menopausal symptoms. There are currently mixed findings regarding whether MHT is effective in treating sleep disturbances in menopause. Kintred and collaborators investigated whether 2 different types of hormone therapy affected sleep domains in women between the ages of 42 and 58 years who have not menstruated for 6 to 36 months. Participants were given one of the 2 hormone therapies, either oral conjugated equine estrogens or transdermal 17-beta estradiol plus cyclic progesterone, or they were given a placebo, or PBO. And then they completed the Pittsburgh Sleep Quality Index, or PSQI, 5 times over 48 months. They found that global PSQI scores were similar across groups at baseline and reduced by both hormone therapies when compared with the placebo. Okay, that concludes my brief talk on menopause and insomnia. I hope this video gave you a glance into the complex relationship between menopause and insomnia, the mechanisms that mediate this relationship, and possible treatments to help cope with this challenging sleep disorder.